Hey guys, Myofascial Mobility Systems here, and we're just going to show you a new video of how to treat the piriformis with the IASTM myofascial blade integrated into your massage therapy treatment. Now you saw Dr. Derek Spence did a piriformis treatment sideline in our videos. Today we're going to show it with the patient on their stomach. So we've already assessed the patient. We found out their piriformis has a couple of issues from scar tissue and it being tight. So we already did a little bit of assessment. We're going to treat the piriformis, a little bit of the glute med, the hamstring, and the gastroc. So we went through all our effleurage, petrissage. We're really focusing on those tissues warmed up in the piriformis. So now we're going to add a little bit of cocoa butter using the myofascial blade. So I'm going to put it on the tip number 1 here, and we're going to apply it across the piriformis, glute med, and a little bit down into the hamstring issues. Now this cocoa butter still has a little bit of, may need a little bit extra, but it smooths down pretty nicely. Now we're not doing any assessment or treatment, we're just applying a little bit of that cocoa butter on top of the oil we already used. So now first, before we actually treat using the myofascial blade, we do a little bit of assessment. Now every time we do an assessment, we're feeling for grittiness, scar tissue, any kind of fascial restriction or tensity. Now you're going to use that 35-degree angle. You can either use this portion here or this portion here to feel where that scar tissue is. So I'm going to start holding it this way. To come down and feel through that piriformis, feel where the rigidity and where that scar tissue is. Now there's a lot going into the insertion of the muscle. Now we're going to come across this way through here. So she has a lot coming up into that glute med, glute max. We're going to treat going this way, and also come across, feel that muscle, and then come down, fall on the fire. Is that a little bit tender? We'll fall into the glute muscle here. So now we've assessed that tissue. We found this little bit tissue here. So my favorite spot of treating piriformis massage is this edge here. It's also edge number 5. We're going to hold it through here, and we're going to treat all through that piriformis. We're still using that 35-degree angle. We're not going too deep. With some athletes or some patients, you'll have to use that 55-degree angle. But we're going to stay pretty superficial using there. Now you can see with her, she's getting pretty red and pretty hyperedemic here. So we're going to back off just a little bit. We're going to just follow those fibers of piriformis. Now we're working on our left leg here, so I'm actually right hand dominant. So we're actually going to switch the tool, still using this edge through here. We also do a little bit of rotation here. So now I'm not very strong with that right hand, so what we're going to do is I'm going to pin down that piriformis using this edge, and we're going to actually move through that range of motion, try to get a little bit of release through there. So what I'm going to do is I'm going to assess, find that restriction mobility, and then go right into that rotation. Does that feel okay?
Yeah.
Good. We're going to assess, find that spot of restriction, and come into that rotation. Good. Now, so I feel like when you get a little bit deeper here to get through that glute, so we're actually going to turn the tool over to access that 55-degree angle so we can sink down into the tissue a little bit more. So I'm going to come right in. Is there a real great spot? Does that feel okay?
Yeah.
And then we're going to come through into that rotation and feel like it's gliding a little bit better. Good. We'll right further to that insertion of the muscle. Good. So now you can see she's really getting hyperemic. It's getting really red. So we're going to go back into it and reassess it. How does that feel to you?
Better.
Good. So that's what we're going to treat with the muscle. Now we're actually move on to the hamstrings here. So hamstrings, same issues, bring up the table a little bit. So I always like to pin with one hand using that pisiform. Bring that skin down. We're just going to assess through that tissue, feel where that gradiness is. Now a lot on the outside here. And feel up through here and use this edge across here. Assess. Or feel it through. Yeah, all right through that medial ham. So I actually get a little bit more cocoa butter, so I don't want to really take up her skin at all. So find that adhesions all into that little bit of that adductor group and that medial hamstring. So what we're going to do is I'm going to take this edge here and come through and work that tissue all the way up. Like I like doing more short, choppy strokes through it. Good. So now with the hamstring, we do the same thing we just did with the piriformis. I'm going to use this edge through here to feel where that tension is. I'm going to break it through the range of motion. So a lot right through the knee. So I'm going to bring her hand up. I'm going to pin down with my left arm, still using that 35-degree edge, and bringing it down. Now we're not actually following any muscle pattern here. We're following where the tension is. So I'm feeling it when we come out a little bit more towards my body. Does that feel okay?
Yep.
Good. So now I'm going to reassess to see how the patient feels with that. Feels less bumpy, less gritty, a little bit less painful. So now what we're actually going to do is flush out the tissues. So we'll do some of that broad stroke. Really loosen up that muscle, see how it feels to your hand, and then go back into that massage. Hey, thanks guys for listening. We're actually going to post down our other video of what we did with the piriformis with the patient sideline. Personally, I like to do it when the patient's prone on their stomach. Any questions, email us at www